Hello friends, Dr. Safavi here from Claremont Dental. Welcome to our series of Tooth Talk Thursday. On our Tooth Talk Thursdays, we pick a topic and we talk to you about different things that are interesting to you. And it could be dental related, it could be health related, it could be anything that you wish for us to come and explore with you and talk to you about and answer any of your questions. And actually, I would love it if you would tell us what are some of the things that you would want us to talk to you about. And you can drop below and let us know where you're connecting from, and also what are some of the questions that you may have, and what are some of the topics that you would want us to talk to you about in the future series. So thank you so much for tuning in and being the best part of Claremont Dental. So today we're going to talk about actually periodontal disease and gum health. So periodontal disease, of course, you know that especially if you're part of our clinic, you will know that prevention is a big part of our clinic, and gum health and giving an overall health and addressing all the issues that you may have are a big part of our the way we take care of our patients and part of our care. So why is periodontal disease extra important during this pandemic, and why I have chosen that topic to talk to you about? The reason is that during this pandemic, we have to optimize our immune system and keep our immune system really high and working at its optimal level. So when we have a chronic disease like periodontal disease that is very common actually in North America, 50% of people in North America have periodontal disease. Millions have gingivitis. So when we have a chronic disease like that, our immune system is taxed. So therefore, when a viral, such as SARS-CoV, attacks us, or any other microbial agent, any viral agent attacks our body, it cannot fight to its optimal level. So that's why it's so important for us to keep our immune system healthy, and especially also a lot of animal studies have shown that actually the viral load stays high in our salivary glands. So that is why if you have actually came to your dentist lately, you have seen that they ask you to rinse with a rinse of hydrogen peroxide. 1 to 1.5% has been shown to have the best effect. So that's what you have been asked to rinse with. That is a guideline from ADA currently, so we can reduce the load of the viral. So, of course, that is for patients who are not showing any symptoms. So therefore, so all the things that keep our gums healthy are important. So, for example, brushing, flossing, any rinse that you have at home that you like to use, keeping a regular dental appointment, either if it is for a regular cleaning or deep cleaning, or coming and visiting your dentist regularly. It is very, very important, especially during this time. However, if we only keep up with the home care that we have, especially during this time, that if you have a difficult time getting into seeing your dentist for your dental routine cleaning, because there's a longer wait period in some of the clinics, or you are worried, which I don't know, why would you be worried to coming to your dentist, because this is one of the safest places to be right now, especially during this time. We have always used preventative measures that we use, and now we are even extra careful. We have air purifiers that actually in our clinic we have an air purifier that is has a NASA technology. It throws out particles that doesn't even surface cleaning. Within a few minutes, it kills everything, including COVID virus. However, in general, this is one of the safest places you can be. But however, I just would like to talk to a wide variety of audience. And so if you happen to come even later, or even if later on we don't know how things are going to be, if during, for example, during the closure time or etc. So if for any reason, if your care gets delayed, you're even more compromised during this time for your oral care. But going back to the subject of, during when we do our home care, even with the best of the toothbrushes, we have, if with the electrical toothbrush or manual toothbrush or whatever that you use, with the best of the techniques and with the best of the optimal time, which is 2 minutes and twice a day, even following all of those guidelines, and with the floss, if we have pocket dips that are deeper than 2 millimeter, which many of us have, we are going to have a harder time getting into those areas, and actually it is impossible to get into those areas. So one of the things that I would like to talk to you about today is PerioProtect. So PerioProtect is actually, let me bring it closer so you can see. So this product has two components to it. It has a tray that is actually an FDA approved tray. I don't know if you can see it. This is a tray that is made for an upper and lower, in the case that your dentist thinks that you would need both trays. Sometimes if the upper is the only one that you need, but mainly it would be for upper and lower. And so it is actually through an impression. It's custom trait to you, and this is not something that we can make in our clinic. It is sent to a lab that they are certified, and they are FDA certified for making these trays. And the best part of this is that for the impressions, especially in our clinic, we are all about comfort. So we use a scanner that for taking our impressions, we scan, as you can see in this picture, we scan your upper and lower jaw, and this is sent to the lab, and they create the tray for you. So now, so that's what makes the tray special. But now let's see why the PerioProtect product is special. So the tray is special the way they make it, because it does have a snug fit. So the delivering of the medicine or the gel or etc. that I will be talking with you about is optimized. So it gives it a really good seal, and so the medicine is able to get to the areas that are in deeper pockets. So you're delivering basically with the best way to your teeth. So now why? And by the way, it comes in this really cute case if you would like to order the case. And it comes with this little booklet that explains to you everything that I'm trying to explain to you here today. So and also there is a page that tells you, and your dentist can mark and say how often they want you to use it, and so forth. And we'll get to that in a little bit more. So, but right now I would like to talk to you about actually the gel. So if you remember earlier, I told you about the hydrogen peroxide and how effective that is because of the oxidizing effect that hydrogen peroxide has. So that's what is so important for the SARS-CoV-2. So for the coronavirus, because of that oxidizing effects, it destabilizes the virus and reduces the load, the microbial load. So this gel, which is the Perio gel, is from the PerioProtect. So this is made with hydrogen peroxide. So, and it's really simple. So what you would do is that you just put like a small amount of this in the tray, in the upper and lower, and you just adapt it to your teeth. And the studies have shown that their optimized time is 10 to 15 minutes. So depending on the stage of your periodontal disease or gingivitis, your dentist could recommend to you to use this once or twice a day, or for 2 weeks for 3 times a day, until you get everything to the point that you can reduce the number of times that you use it during the day. So, and sometimes your dentist might recommend some other medicament, some liquid medicine also, that you would put in the tray. So you put the gel and then you put the medicine, and with the brush, you just brush around that liquid medicine and you apply it again. So it's different from the bleaching trays, because bleaching trays, they are less sensitive, and so the bleach can be applied. However, the wonderful thing about, that's why I love this product, because it is not just addressing one thing, and it addresses multiple things. So one of the things that it does, so it does multiple things, so I'm going to name them to you. So one is that actually it gives you a healthy gum. It reduces the bleeding, reduces your pocket depths. If you remember, when you go to the dentist, they record when you're doing the probing and measuring your gum levels. One of the things that are important are that you hear all these numbers, and they usually tell you if your number is under 3, it's healthy, and anything above 3, it shows disease, especially if you have bleeding. Bleeding again shows active disease. So it reduces bleeding. It reduces your pocket depths. It also gives you good breath. So that's the very best part for me, that I feel that's so attractive to many of my my patients. And also the last part is that it also does do whitening. So I think that's why I really like this product, because it does so many things that are so important to many of us at one shot. so I personally love using it when I take a shower. So I put it in, and I start, as soon as I wake up and I want to get ready for the day, I go ahead and put it in. And if the optimal time is 15 minutes, but if it goes longer, it's fine. You just put it in and take a shower, get ready, and then you remove it. The important thing is for you not to rinse afterwards. And if you, as soon as you put it in, if you feel some of the gel comes out, it's okay, just spit it out, and just know that next time you just use a little bit less of an amount. And I forgot to say that it has a really nice, cool mint taste to it. So then so then you use the gel, and also so let me think, I lost my train of thought. So let me think where we were: the whitening, the bleeding, the breath, the fresh taste of the gel, and of course, the effect of the hydrogen peroxide reducing our microbial load. So, this is what I was going to say. And some people actually like to do it at night, especially if you are recommended to do it twice a day. So you would also use it. Some people like to do it if they're relaxing in front of the TV, or in front of the computer, or anything, that a few minutes before going to bed, you just pop it on again and put the gel, put it in, and do your 10 to 15 minutes routine. And many patients actually find it easier and easier as they use it, as they see the benefits. They don't even think about that how many minutes it is or how often they need to do it. They just love the feeling that they get after using it, so they enjoy using it, and they have easily implemented it in their routine. So I'm so glad that you connected with us today. Thank you so much. If you have any questions, please drop below. I would love to get back with you and explain more if we need to do another session on PeriProtect and explain to you more about it. I would love to do that. If you would like to contact our office and ask us any questions, I will be more than happy to offer you and be a resource for you. We always offer a 30 minutes consultation. We can do it virtual also during this time. So we are here for you and would love to be a resource for you. Be well and hope to see you in our next series. Have a lovely day and keep smiling.